Good afternoon, everybody. I'll be presenting on cancer and fatigue, and if there's anything that you can do about it. My name is CindyMarie Mack, as it says below my image, and as Cheryl mentioned, I'm the OT with the AYA program. For disclosures, my role is supported by the CancerCare Foundation. So that's a disclosure. And then the only other thing is I'm also an OT over at Deer Lodge on their Jerry Rehab unit. So we can go to the next slide. I've got no mitigating potential biases that I know of. I have reviewed the wonderful materials on equity that were provided to us by the organizers of the event and have tried to put that into my presentation going forward. So we can go to the next slide now. So learning objectives. By the end of this presentation, I hope that you'll understand the difference between general fatigue and cancer-related fatigue. And I hope to be able to arm you with some concepts and strategies. So tools for your toolkit of how you can reduce the symptoms of your cancer-related fatigue. So some of the topics that we'll cover, some of those tools to build into your toolkit, are understanding the boom-bust cycle, what it is and how you can avoid it. We'll talk about energy conservation, and there's 3 main P's: prioritizing, planning, and pacing, that are involved in energy conservation. We'll talk about restorative rest, activities that you can do to sort of recharge your energy battery. We'll also talk about sleep hygiene or sleep habits that you can use to try to help you have a better sleep, because if you're underslept, that's just going to make you more fatigued on top of everything. We'll talk about diet and exercise. We've had some great presenters already that have talked about those things, so I'll keep that one short and snappy. And then I've got a little bit on SMART goals. I know last night our main presenter talked about SMART goals. Her SMART goals had an extra T at the end for togetherness. Mine's just the regular SMART goals, but still worth a review. So we can go to the next slide. So cancer-related fatigue, does it differ from general fatigue? So general fatigue, Merriam-Webster Dictionary, has defined it as a weariness or exhaustion from labor, exertion, or stress. So the key thing here is that there's a reason for your fatigue. You've done something, whether that's go for a long run or working hard on something, and that is what brings on your fatigue. With cancer-related fatigue, so this is the National Comprehensive Cancer Network that has created this definition. So it's a distressing, persistent, subjective sense of physical, emotional, and or cognitive tiredness or exhaustion that's related to cancer or cancer treatment, and it's not proportional to recent activity, and it usually interferes with your typical usual functioning. So this is a jam-packed definition. One of the things here is that it's distressing. So it's very troubling when you're experiencing this. It's persistent, so it doesn't get better with rest. It can be physical, emotional, or cognitive. So oftentimes people talk about brain fog, and chemotherapy can have an effect on your cognition, but also just this cognitive or this cancer-related fatigue can affect all different aspects. And then, yes, it could be related to the cancer or the treatments that you're getting. And it doesn't matter if you've rested necessarily, it may still be there. It doesn't necessarily get better with rest. So we can go on to the next slide. So I've got my first poll here. So let's see if this works. So here's I'm going to try to publish this. See if that worked. Can you see the poll? Let's see. Show on stage. That's what there we go. So, oh yeah, people are voting. You can see it. So have you experienced cancer-related fatigue yourself? Seems like we're talking to the right people here. You're here to find out some strategies. So yeah, I think we can probably close that poll now. So yeah, we can go to the next slide now. So 59 to 100% of people who have cancer report cancer-related fatigue. So you're not alone. That doesn't necessarily make it easier, but sometimes it is helpful to understand that this is a very common symptom. It's often the symptom that people share the most with other cancer patients. It can be long lasting. Sometimes people, even after treatment, are feeling this cancer related fatigue, and that can be distressing. It sometimes has very long term effects. Sometimes it just takes a few months after your treatments that you're still experiencing this. So, just want to validate for you that it is different than regular fatigue, and you're not alone. So we can go to the next slide. You might be wondering what causes this, and if you were in the keynote speakers presentation last night, you'll know that it's multifactorial, meaning it can have lots of different things that are causing this or playing into your cancer-related fatigue. So the cancer itself can cause fatigue. The treatments for cancer, so if you've had surgery, if you're having chemo, if you're having radiation, in our systemic therapies presentation this morning, we learned that radiation, one of the biggest side effects from that is fatigue. So the treatments themselves, even medications that you might be on, may cause fatigue or drowsiness. So that can be playing a factor. There could be things going on within your own body. So there are cases of anemia that happen either through the type of cancer that you have or your body trying to fight the cancer. And that's low red blood cell count, which means that they carry oxygen to all the different parts of your body. So if you're not getting the oxygen that you need, that will make you feel tired. Stress, and there are so many different types of stress. Just having a diagnosis of cancer is a stressing situation, and there could be financial stress, relationship stress, all different sorts of types of stress that will also contribute to your cancer-related fatigue. Poor sleep. If you're not feeling well, it can be difficult to sleep. You may be sleeping during the day, which can affect your sleeping at night. If you have your muscles are getting weaker because you're not active as much, it's a downward spiral in some ways because your muscles get weaker and then things are harder with the things that you're trying to do because your muscles are weaker. And then, of course, if you're not able to eat as you were eating before, that can have an effect as well on your strength because your nutrition is so important. So we can go to the next slide. So our boom bust cycle, what is it and why should I avoid it? So this may resonate with you as well. When you're feeling good, you try to do all of those things that have been waiting on your to-do list that you haven't been able to do because you've been so fatigued, and then you bust. And for the next couple of days, a week, you can barely get out of bed. So that cycle of doing too much one day when you're feeling good and then not being able to do anything the next day. So if we go to the next slide, this boom bust cycle it's frustrating because it's very unpredictable, your energy levels. And so you can miss out on things that you had scheduled, that you wanted to do, that you were looking forward to. And yeah, so the hope is to be able to have more consistent energy levels. So we can go to the next slide and see a little bit about how we might help with that. So we'll talk about energy conservation and the 3 Ps. What are they and how you can apply them for more consistent energy? So I'm going to go through a couple of analogies here. The first one, I think we all have smartphones these days. So that analogy of the battery life of your smartphone. So often we plug in our phones at night if we remember to. And so we start our day with a fully charged smartphone battery, and ourselves as well. When we wake up, that's usually the most amount of energy that we wake up with. And the old school batteries used to get to the point that they would drain faster. They've come a long way, but you may resonate with that idea of your energy levels or your battery not lasting through the day like it used to. And with our phones, we try to avoid that low battery indicator. And we often think, oh my gosh, did I bring a charger with me? How am I gonna make my battery last? So energy conservation is your way of trying to avoid that low battery indicator. So again, just sort of fleshing this out a little bit more, the goal is to avoid getting into that low battery life or your low energy. So yeah, trying to check your energy levels throughout the day, tune in to how you're feeling. it's really important that you know what drains your battery. So, what things take away your energy and what things build it up. Consider using that low battery mode. So, on our phones, they're very smart. It's right in the name, smartphones. So, that low battery mode will kick in just like just happened right now. My video has been taken away because it was taking up too much of my internet usage. So now you're just getting to see my screen. So doing that with yourself, trying to figure out, is there a way that you can make the activity that you're trying to do um, an easier version, a more analog version of that same task? And then trying to save your battery for what's most important to you. So one of the P's we'll talk about, we'll go a bit more into detail here. And then recharging your battery as well as you need it. So that might be taking a seated rest, that might be engaging in some restorative activities. Um, and then sometimes it's just letting someone else use their smartphones for those apps. Like I know Google Maps drains my battery like crazy. So if I'm on low battery, then someone else is going to have to be the navigator. So another analogy is the piggy bank or budget analogy. So same sort of thing. The goal is to avoid running out of money before the end of your day. It's important to know how much money is in your piggy bank, so how much energy you've got. Because if you've got something coming up that's going to need a lot of energy or a lot of money, you'll want to make sure that you've got enough to do those things that you want to do. Know how much things cost, so knowing what activities are more draining, and then again thinking about a more affordable option of that task. So how could you change the task to make it a little bit easier? And then spending money on those things that are most important and letting someone else pay for it if you can't afford it. So, the three P's that are associated with energy conservation are prioritizing, planning, and pacing. So, for prioritizing, ideally, you could make a list of all the things that you need to do in the next month. And I know December is often a very busy month for everybody with the holidays. So, if you have a chance to look at all of those things that you have to do and make sure that you include things like your normal everyday activities. You still need energy to get yourself washed and dressed, get your groceries, make your meals, all those sorts of things. And then from that list, identify what is most important to you. So, it will vary from person to person. This is a very you-centered thing. So tapping into your values and defining of that list, what do you want to spend your energy on? And again, consider adapting a priority to make it more manageable. So if it's making a big family meal for the holidays, maybe instead of you making the meal, you turn it into a potluck. So how can you still have that thing that's important to you be a part of your day, but make it a little bit more manageable? And then also, when you're prioritizing your list, if you write down how long those things will take, that's important. And then indicate how much energy a task will take. And so you can do that. If we go to the next slide, you can just simply put little stars, 3 stars, or you can make it out of 5. It's going to take more energy to do this particular thing, or it's a medium amount or a small amount of energy, an easier thing to do. So it's really important that you think about the time and the energy that's needed so that you can make a realistic plan of what's achievable given the time and energy that you have. So I've got an example on the next slide. So often people's priorities in the month of December are getting gifts for family members or friends. So looking at writing out the times and the energy levels, making that list of who you need to buy for, that might take about 15 minutes. Doesn't take that much energy. Brainstorming for gift ideas. Well, depends how much time you want to spend per person, or if you're a perfectionist that wants to really try to figure out the most, the perfect gift. And then that one might take a little bit more energy. And then if you're going to the mall to go shopping, that, you have to make sure that you remember that there's travel time that's involved. You've got the amount of time that it takes to shop for each of those gifts. and then times that by the number of people you're shopping for. And that one is a pretty big energy drainer because you're physically being very active, your mind is working, you're trying to make decisions. That can be fatiguing. And then you've got to wrap those gifts, and that can take some time. And that also is probably about a moderate amount of energy. So on our next slide, we see a more manageable way that this could be done. So this is that idea of changing the task to make it less energy draining. So that low energy or low battery mode. So you could just take 10 minutes to send a group text to your family members and say, hey, could we switch it to a gift? It can take just 10 minutes, maybe less, and then brainstorming for just one gift. You can set yourself a maximum amount of time. That shouldn't be too taxing. And then you could do online shopping instead of going to the mall. Set yourself a max amount of time that you're going to spend doing that. And then instead of wrapping it, just pop it into a gift bag. So that's an example of making something that's a priority, making it a little bit more manageable. So then planning, now that you know what your priorities are, how long they're going to take, and how much energy they are probably going to take you, this is where you get to make a realistic plan of when you're going to do these things. So remember, when you're planning, plan to pace yourself. So we'll get into pacing in a moment, but trying to keep your energy levels in mind as you schedule your tasks. Spread those things out throughout your day, throughout your week, throughout your month, so that you have an even amount of energy. Plan also to put in some restorative rest. So some activities that are going to recharge your battery. It's like being able to plug yourself into the wall if you were a smartphone, or having a battery charger along with you. So planning those rests, marking down those tasks on your day timer or calendar, and then make sure that you include the time and the energy levels that each task might take. If you've got this on your calendar or your day timer, then you can see at a glance if something comes up that someone invites you to, or there's an emergency that you have to take care of something, you can take a look at your calendar. You can see, is there a better day to add this thing in? Can I shift some things around so that I have that even energy? Because I don't want to have too many draining things on one day. And then this is also maybe a time where you ask for some help. Lots of times people will say, is there something that I can do to help? And often there's no answer, but you can make a big old list. And if someone does offer, just say, hey, you could go do my grocery shopping for me, or I need this picked up at the mall. When you're planning, remember, if there's too much to do, given your time and energy, there's simply too much to do. So you can go back to that prioritizing, decide what you can set aside for later, what can be made more manageable. So like that example of the gifts, just switching it to being a gift exchange, or could someone else do it? So this is sort of the 3 Ds of energy conservation, where you can delegate the task, you can defer to a different day, or you can just delete it or ditch it altogether. So then with the pacing, you want to try to pace yourself within the tasks that you're doing. So trying to break those tasks down. That could be if you're doing laundry, you've got that on your list. Instead of sorting it, taking downstairs, putting those loads in, bringing it back up, sorting it, putting it all away, that can be quite draining. You can sort it while you're sitting down, and then maybe later that day, or maybe even the next day, you can take seated rests between, or just take a whole day between and continue on with that task at a later time. So really trying to pace yourself and stay tuned into your energy level. So how we can do this is thinking of our fatigue on a scale of 0 to 10. With cancer-related fatigue, it's a very good day if you're at that 0 level, I'm aware, but trying to keep yourself in that mild zone. So, 1 to 3 is mild fatigue. If you start getting into that moderate level between 4 and 6, then, trying to take a little bit of a break, maybe even take a break before you get to that point. You really want to try to avoid the severe and the worst case scenario. And with that boom bust cycle that we were talking about, often you're in the mild range. So you just really go all out on a day, and then you end up in that severe or worst for a few days afterwards. So try to take that rest early and really try to tap into your energy levels that way. And you can also see if there's any trends in your days. You might find that mornings aren't really the greatest for you. It's afternoons when you have the most energy, or vice versa, that you've got more energy in the morning and then it just sort of gradually depletes over the day. So trying to tap into those things as well. And then by doing this prioritizing, planning, and pacing of your energy conservation, it allows you to be more intentional about where you're spending your valuable time and energy. And also, you're more mindful of your energy levels and what drains or charges your battery. Sometimes we don't tune into these things, and that's often when we end up in that boom bust cycle. And then the goal, of course, is to have more sustained energy throughout your days and weeks. So that's my next poll. Let me pull it up here. So, energy conservation techniques, publishing this and showing it on the stage. So, after that little review, let's have some votes here. Do you understand these 3 Ps and how they can help you avoid that boom bust cycle? You can vote for more than one here too. So do you think you might try these 3 Ps, or you're okay with that boom bust cycle? You're used to it. You're going to stay there. Someone's okay with their boom bust. Fair enough. If that's working for you, you do you. But yeah, these strategies can be helpful. So glad to see that some people might be giving that a try. So let's go on to the next. So restorative rest. You might be wondering if this includes a 3-hour nap or binge watching a series, a whole season of a series. Restorative rest is actually, to use our analogies again, it's recharging your battery or refilling that piggy bank. So restorative rest, we can go to the next slide now. It will probably look different from person to person and might depend on your mood that day as well. But often for people, being in nature can be a restorative activity. Taking a bubble bath, walking your dog, playing with your cat, yoga and meditating or mindfulness, those are often helpful things to try to charge our battery back up. Studies have shown actually that listening to music, like just really sitting there and listening to music, can be helpful to recharge our batteries. Knitting or crocheting might be your thing. Talking to friends who are just, they fill our cup, they recharge our battery. That could be something that you could plan in your day to help charge your battery back up. Journaling or keeping a gratitude journal, and for some people, praying. So any of those activities that recharge you. Restorative rest isn't the same as a distraction. And yes, it's true. Sometimes a distraction is what we need. That's what the doctor has ordered. So binge watching a series or scrolling on social media, although warning about social media, you guys all know that can bring you down as well. So distractions can take our mind off of things. And if that's all that we need, that's fine, but they don't necessarily recharge or restore our battery or fill us up. So I encourage you to think about what restorative rest might mean to you. Figure out what leaves you feeling restored or refreshed, recharged, energized, whatever word resonates most with you. And whatever that looks like for you, make plans to sprinkle that good stuff throughout your day. So put that into your schedule. And so restorative rest is helpful for your emotional well-being. It can help as a great stress reliever. Sometimes we need more than that, though. So I know in our earlier presentations, a few presentations now, they've been talking about all of the things that are available through CancerCare. So these are free services that are offered. There are professional counselors. They're called psychosocial oncology counselors, or PSOs. There are also support groups. There's lots of group programming as well. and one-on-one peer support available. So on the next slide, I just have a list of the phone numbers for these places. There are different numbers associated with the different health regions. So probably easiest to just pop onto the CancerCare website and type in supports, and it will take you to the page and you can find that information. So we'll do another little poll. So for your restorative rest activities, are there some that that you use? Did you maybe get some ideas of things that you might want to try? You've got some favorites, but you haven't been able to really engage in them lately? Yeah, great. So have most people know what helps. Sometimes it's just reminding ourselves that this will be a useful thing to help restore our batteries. So for those that have some favorites but haven't thought about them in a while, maybe taking some time to schedule it in so that you can engage in those things that you do know will help to restore your energy levels. And then, so about those 3-hour naps, we'll talk about sleep hygiene or sleep habits next. So what is sleep hygiene and how can you use it to have a better sleep? So our bedroom environment is important. It's best if you can keep it a little bit cooler than your typical room temperature. Keeping it nice and dark encourages staying asleep. So if you've got light sources coming in through your windows, if you can get some blackout curtains, or I have friends that when they go to hotels, they actually have garbage bags that they just use painter's tape to pop into the windows because they don't want their toddler to be awoken by the light streaming in. Your bedroom environment should be calming and relaxing. So trying to keep clutter to a minimum. You should feel relaxed when you walk into your bedroom, not like you've got a million things to do lying around. So if you're the type of person who likes to leave your clothes out, maybe finding just a little bin that they can be put into, just so it's a calm, relaxing environment that you're walking into when you are heading into bed. And then white noise or sound therapy. So there are some free apps. There's also machines that you can purchase that will give just a little bit of background noise. Some of the apps you can choose the noise that you would like or the sounds that you would like. There's rainforest, there's thunderstorms, there's all different sorts of noises. So if something in your home were to wake you up in the middle of the night because it's a sound that's disruptive, the white noise or the sound therapy can just sort of muffle that so that it helps you to stay asleep because you don't notice that sound so much. And then the bedroom should only be for sleep or intimacy. So no TV, no computers and work in there if at all possible, or if you have to have your workstation there. I know throughout COVID, a lot of people transitioned to work from home. So trying to keep some zones so that the bed area feels like that's where you sleep and where intimacy happens. And then some things to avoid before bed. So I think we all know that caffeine is a stimulant. It helps you feel, well, for most people, it makes people a little more awake. So trying to avoid that, like around 3 p.m. or so. Alcohol, this one is often a one that makes people go, but alcohol is a depressant, so it will make you feel sleepier if you're drinking. Well, whenever you're drinking, it can make you feel a little tired. So it might help you fall asleep, but then it doesn't keep you in a deep sleep. So you end up waking up in the middle of the night often. So it's not the helpful thing that you might think it is. So trying to avoid alcohol before bed. A big meal before bed can also mess with your sleep. So if you want to have some little snacks, that's fine, but try not to have a big meal, try not to have anything spicy right before bed. Strenuous exercise, trying to avoid that within a couple of hours of bedtime as well. And then screens. So the blue light that comes off of our computers, our smartphones, our TVs, our system reads it as the same thing as sunlight or daylight. And so our circadian rhythms think, oh, I got to be awake. This is daytime hours. So if you can, oh, we can stay on that previous slide. If you can, try to avoid screens before bedtime for like an hour before bedtime. If you can't, the harm reduction way is to, on your smartphone, you can go to the dark mode, have that on your phone so that at least there's less blue light being emitted from your screen. On your computer, there are some apps that you can have installed so that you can actually set it to different times of the day that it goes to a little bit more brownish. It takes a bit of the blue light off of it. So ideally staying away from screens, but if you can't, then trying to find ways to at least make it less blue light that's coming off of those for you. Now we can go to the next slide. So one way that you can maybe avoid those screens before bed is to create yourself a little bedtime routine or ritual. So that doesn't include TVs or screens. So that could be taking a bath. That's actually quite a helpful one because it helps to um, your core temperature rises when you're in the tub, and then your body tries to cool yourself off, and that gets us tired and ready for sleep. So there's a reason why with little toddlers and kids, they often have a bath as part of their bedtime routine. Reading, so not on your phone if you can, or with the dark mode if you're going to be reading on your phone, but a book or a Kobo or Kindle, meditating, mindfulness. There's also some apps where there's bedtime stories read by famous people, which they have stories that can be read by these actors. I think Calm is one of the apps that has that as an option. So just trying to create something that helps encourage your system to realize, okay, it's time to relax, time to go to sleep. And then if the TV before bed, trying to veto that is unpopular, this one might be even more unpopular, but really trying to go to sleep and wake up at the same time every day, even on weekends, or even if you've had a not the greatest sleep, it's helpful to keep those circadian rhythms the same. If you've ever traveled a few different time zones, you know that when you have jet lag, you just feel loopy and not great. So your body system wants to keep a regular circadian rhythm. So trying to keep those same sleep times and wake times every day. And then if you're finding that you've either gone to bed and can't fall asleep, or you've woken up in the middle of the night and you're not sleeping for more than 20 minutes, get out of bed and go somewhere else and engage in some restful activity. So something that will make you feel a little tired, maybe something even a little boring. And then once you feel tired, go back to bed so that you're not associating the bed with a struggle to sleep, but that's where you go when you're ready to sleep. So next poll. How long do you think your nap should be? 20 to 30 minutes, 1 to 2 hours, as long as your body needs. I've got a few people saying 20 to 30. A couple people, 1 or 2 hours. A few people, as long as your body needs. Yeah, so the majority thinking 20 to 30 minutes. Yeah, still the majority thinking 20 to 30 minutes, and that would be correct. So we can go to the next slide. So you're first falling asleep, your sleep levels don't go as deep. The longer you're sleeping, you go into those deeper levels of sleep, and they're harder to wake up from. So if you're taking longer naps, again, you wake up feeling sort of that jet lagged, groggy feeling. It's harder to get yourself up. You probably end up just staying in bed longer. So if you keep it short, like the 20, 30 minutes, you just go into that first sleep cycle and it's easier to wake up from that. Now, of course, if you're exhausted from treatment and you feel like you truly do need just a longer rest, then and you are sleeping at night, then you can take what your body is telling you it needs. But if you're having difficulty sleeping at night, especially, trying to keep those naps nice and short. And then you might try what's been dubbed a nappuccino. So if you have a caffeinated beverage before your nap, it typically takes about 20, 30 minutes for caffeine to hit its peak levels. So it's kicking in just as you're getting up from your nap. So you might want to experiment with that one. So moving on to diet and exercise. So I'm sure you're thinking you're tired without even exercising, and diet's a four-letter word. So um, we know that they're both part of a healthy lifestyle. With so much on your plate, why can't we just give you a pass on this? So if you were in on any of the earlier presentations, you know from the wonderful presentation by Robin Chambers, one of our nutritionists or dietitians, that your nutrition and your energy go hand in hand. So the better your nutrition, the more energy you're going to have. Yeah. So, and I know it can be hard to eat well at the best of times. And when you're on treatment, those medications can cause issues like nausea and vomiting. Food can taste different. The way that you chew, swallow, and digest, and also get rid of your food can change depending on what kind of surgery you may have had, what treatments you're on. So I understand that it can be a challenge, but yeah, and you've already got fatigue that you're dealing with as well. So just a reminder, I know if you did attend that presentation by Robin, the Canadian Food Guide recommends half of your plate being fruits and veggies, a quarter being whole grains, and another quarter protein. Um, Robin also shared that when you are in cancer treatments or working through your cancer experience, you might need as much as 50% more protein. And water is the drink of choice that's recommended by Canada's Food Guide. Robin was saying too that water cannot taste so great, so she had some strategies adding flavor enhancers, but making sure that you're staying hydrated, because that can also contribute to fatigue if you end up being dehydrated. If you have any questions about making better choices for your nutrition or just tweaking things, we have free nutrition services through CancerCare as well. So there's numbers there. You can self-refer or you can ask your team to get you connected. So then moving on to exercise. How can it make you less tired? Well, if you were in the keynote speaker session last night, you heard Dr. Koulis Reed talking about all of the amazing things that happen when you can keep yourself active. So we know that it builds your strength back up or keeps it from diminishing. It can help you sleep better at night. It has great effects on your mood, and studies have shown that it really does help to decrease your fatigue, even though that might seem counterintuitive. So remember, you don't have to train for a marathon or join a hockey team. It's movement, right? Yesterday, Dr. Koulis Reed was talking about just, stretching, moving your body around a little bit. Even as you're sitting listening to me right now, you can do some stretches, because our body, when it holds tension, that can be fatiguing as well. So next slide. The 24-hour movement guides for Canadians is 150 minutes of physical exercise while you're going through your cancer treatments. We learned yesterday from Dr. Koulis Reed that 90 minutes is sort of the goal while you're going through cancer, but that you can stay active no matter where you are in your cancer journey. But this is the goal to work towards. Doing some activities that strengthen muscle groups at least 2 times a week, that was consistent. And just trying to move, just trying to be up and standing and do other light things. So remember, exercise is physical activity, is movement. And the best type of movement or activity that you can do are the things that you like. So trying to remind yourself of what things bring you some joy, maybe adapting that to make it a little bit easier for yourself. Walking is a really great activity if you can do that. Well, now it's snowy out there, but being able to get out in nature for it is also a great way to get moving. So we can go to the next slide. So SMART goals. Again, if you were watching last night, this will just be a review for you, but yeah, what are they and what makes them so smart? I'm sure you're getting lots of great information from this weekend's conference. Hopefully you'll be inspired to create some new goals for yourself. And the best way to be successful with those goals is to make them SMART. So SMART is attainable. So making sure that it's not beyond your reach and that it's not too easy. Make it relevant. Sometimes the R is used for a different word, but relevant. It needs to resonate with you. It needs to be something that you feel is worthwhile working towards. And then time bound as well. So if you give yourself a time frame that it's going to be done, that's also super helpful. So an example of a SMART goal, if nutrition was one of the areas that you thought you might like to make a goal, your goal might be, I'm going to get some advice from a dietitian so that I can eat better during my cancer experience. And so that's a great goal. But to make it a SMART goal, you could make the goal of, I'm going to call that number for nutrition services by the end of the week, and I'm going to get an appointment set up. So that gives you something that's specific, it's measurable, you've done it or you've not. It's an attainable thing, it's relevant to your goal of getting some better advice, and it's time bound because you've got to the end of the week to get that one done. And then if sleep habits, if you thought, oh gosh, I'm going to need to overhaul all of my sleep habits so that I can get a better sleep. Again, great goal, but choosing something that's going to be specific, measurable, attainable, relevant, and time bound. You might think, okay, by the end of the weekend, I'm going to get someone to come over, help me to pin some garbage bags to the inside of my bedroom curtains, cover up my bedside alarm clock, because sometimes there's a lot of light coming off of those things, so that you can have a nice dark environment in your bedroom to help you sleep better. And then one last example of a SMART goal. Your goal might be to just get off the couch more, and making that a SMART goal. You're going to walk the length of your apartment hallway a minimum of 5 times this week. And you might want to even connect it to lunchtime or something so that you've got a linkage to something that's already part of your routine. So just to review the tools that you now have in your toolkit, you're now, if you weren't before, you're now very much aware of that boom bust cycle and how it is best to try to avoid that, and using energy conservation and those 3 Ps. So prioritizing, planning, and pacing are ways that you can try to avoid that boom bust cycle, tapping into those fatigue levels, remembering those 3 Ds as well. So delegate, defer, or ditch it altogether, and restorative rest. So a lot of you were saying that you'd like to try to find something that re-tap into those things, or already things that give you energy and charge your battery. Sleep habits. So you may have learned some new things through that review of what sleep hygiene is. And then diet and exercise as well. We're getting lots of reinforcement on those two, nutrition and exercise, and how important they are. And then SMART goals. We've had 2 sessions now where we've talked about those, so trying to make sure that you've got a way to make those goals specific, measurable, attainable, relevant to you, and time bound. So got one last poll here. So just wondering, do you feel that you've got some new tools in your toolkit that could help you manage your cancer-related fatigue? And maybe you don't. Maybe you feel like none of these were new, or maybe they weren't helpful, but hopefully you've got at least one new idea. You could vote for more than one here as well. So if you feel like you've got some new ideas and you're going to make a SMART goal by the end of today, that's fantastic. I see some little hearts coming up too, so that's wonderful. Oh, someone didn't get anything beneficial. Well, I'm glad that many people did. So we'll put that away. And then, yeah, so the last slide here. So the take-home messages, my goal was to have you leave this presentation understanding that cancer-related fatigue is different than general fatigue. Feel free to share that that awareness with those around you as well, so that they can better understand that it is different. And so when you say you really don't have the energy, that they understand that it's different than the type of fatigue that they might feel. And then my hope is to empower you with some concepts and strategies for your toolkit. So my next slide is just references. And then I just want to say thank you so much, everybody, for taking the time to attend and listen to these tips and strategies.
Hi, John. You can zip me in, please. Hi there, Cindy Marie. Can you hear me?
I can.
Oh, great. Thank you so much for that presentation. I don't know if you can see, but there's all kinds of hearts and cool smiley faces and thumbs up. So lots of people really appreciated your presentation, as did I.
Well, that makes my heart very happy. I'm glad that there is some
Absolutely.
yeah.
Yeah. Do you want to try turning on your camera or should we just sort of leave the Wi-Fi?
I will defer to John. He's the magician and the guru, and
I know we really need our backstage folks, huh? Well,
oh, he's saying
um,
on. So let's see. I'll try turning it
okay.
on. If
There
I
we go.
if I
Yeah,
glitch away, then, will turn me back off. But
absolutely.
we'll s
Yeah, so no, great job, CM. And so while you are getting settled there, and I see that, oh, are you back, Cindy Marie?
I'm here. I think
Oh,
John
great.
thought that he didn't wanna see me.
No,
That
not.
it was messing with the connection, so, yeah,
Oh,
you'll just have to
we'll
deal
just
with my
leave
picture.
we'll just leave things as be, and it's a lovely picture. But
Okay.
I'm just seeing here, Cindy Marie, some questions coming in through the chat. So do you want to give it a go?
Sure.
All right.
Um, so I'm not sure if I'm at the
Oh, no,
top
I'll
here,
read
I'm
it
not
to you. Yeah, I'll read it
okay.
to you, Cindy Marie. First question: how long after cancer treatment finishes can one still consider fatigue to be related to cancer? So, example, like, does it have lifelong effects?
Yeah, so that's a really great question, and it kind of is person dependent. Um, most people do have some relief in their cancer-related fatigue, like a number of months or sometimes a few years after treatment. If it's long term, though, I would say speak with your physician and just say, "Hey, I'm wondering, is there something else that might be contributing to this fatigue? Maybe it's still from my cancer, but maybe there's something else if your thyroid levels are out of whack or if you've got anemia or something like that, there can be other things that can contribute to fatigue. So I think if you've had cancer and you've experienced that type of fatigue, it's, your assumption is that it's from the cancer and it may be, but yeah, there's no cookie cutter answer for how long it lasts. It's kind of different for each person. So I would encourage you to just chat with your GP about it and see if there's some tests that he can run just to rule out other things and then take it from there.
Absolutely. Yeah, it's hard to sort of delineate what's due to what, right? So,
Mhm.
okay, so next question. I completed chemotherapy for ovarian clear cell carcinoma, but I also have chronic fatigue syndrome. I'm still struggling with fatigue beyond my normal. I'm grateful for suggestions or studies that I can read.
Okay. Yeah. That's that's a double whammy there for sure. I'm not aware of any specific studies that combine those two. I could look some things up and see what I could find for you, but I would say, Bridget, that um, these strategies will work no matter what type of fatigue you're experiencing. Yeah, so people with different disease other types of health conditions, obviously chronic fatigue syndrome is right there in the name. But these types of strategies sort of are overarching strategies that can be used across the board. So, yeah,
Yeah,
I would
tried and
encourage you to
true.
give these a try.
Absolutely. So, another question here, Cindy Marie. I can barely tolerate the fatigue now. What will I do when I have to return to work shortly? I am exercising and eating well. I don't have any more energy.
Yeah, so that is a very difficult scenario to find yourself in. Um, I would say talk to your oncologist because they can fill out some forms. Like if you don't have the energy to do those things that you need to do in your day to start with, then adding work to that can just make it impossible. So talk to your oncologist and find out if they feel that you're ready to return to work. There are graduated return to work that can often be accommodated. There are accommodations. So, a workplace by law is bound to attempt to accommodate the recommendations for a gradual return to work unless there's undue hardship on their part. But I would say reach out to your oncologist, reach out to your HR department if the place that you're working has HR. Talk to them about a gradual return to work and what that might look like. The PSOs, the psychosocial oncology counselors, many of them are social workers, so they might be able to help you figure out financially what things might be open to you as far as disability that you could potentially get. Maybe you can speak a little bit to that, Cheryl.
Absolutely. Yes, as CindyMarie was saying, there's a lot of variables and different things to consider for return to work, and we have seen different scenarios. So, what she said about talking to the employer and any case managers that are involved, but we do highly suggest a gradual return to work because ultimately that increases the chances of success, right? That you're not
Mhm.
returning Monday to Friday full time, 40 hours a week.
Mhm.
That would be probably the number one strategy, huh, Cindy Marie?
I would say, yeah. And with the adolescent and young adult program, so if you're 15 to 39 and you're looking at a return to work, you could reach out to our program. And as the occupational therapist, it's not all about occupation, but I do some return to work. But it's really all of the occupations or jobs of everyday life that I'm focusing on. So those things,
Yes, it's a sort of a holistic assessment. Absolutely. Um,
the
Another
cancer
question.
experience is impacting. Um, yeah. But yes, so if you're, sorry, go ahead, Cheryl.
I'm sorry, Cindy, I think we're glitching, so we're dancing a little bit.
Okay,
Please go
sorry.
ahead.
Oh, I was just gonna say, if you're in that, age range of 15 to 39 and you're looking at return to work, then we could set up a session and we could talk about what return to work might look like. I can help create a letter of accommodations as well that you can take to your employer or your HR just to try to think through those things that might make it a little bit easier for you when you return to work, for that
Absolutely.
gradual return to work. Yeah.
Um, Great. Oh, and you got, Cindy Marie, a compliment. Great analogy with the battery indicator.
Oh, good.
I, I like that one too. And also, what exercise can I do with my arm that has a pick line?
Yeah, so I would say, like Dr. Kulos Reed was saying, if you have something very specific like that, getting clearance from your oncology team, so from your doctors, ask them what sorts of things um, would be beneficial to do. If you didn't attend that session last night, there's the Excel program through the University of Calgary. They have a very comprehensive assessment that they do to clear people for different activities. Um, a physiotherapist could probably also help you figure out what sorts of exercises and movements would be safe for you to do. Sorry that I'm not as much help on that one.
Oh, no. I think that's a great suggestion. Another question here. Should you try to defer the nap or rest or take the time right now when you feel that you need it?
Yeah, so I would say taking the time. So, like when you're tapping into those fatigue levels, if you think about that scale of 0 to 10, if you need a break, you need a break. So, it may not need to be a nap, but just taking a rest. So, taking that restorative activity. And like I said, if you can try to figure out if there's certain times of the day that you have more or less energy, and also just the types of activity that are especially draining, so that you can try to do those demanding things at the times when you know you have the most energy or typically have the most energy, and but trying to change that activity so that you can put those breaks in between. So I would say, yes, definitely take the break before you get too tired. Otherwise, you may end up in that boom bust cycle again.
Good tip, Cindy Marie. Absolutely. Another question here. What would you recommend if even mild exercises cause significant increase in fatigue?
Yeah, so you wanna make sure that you're staying within that mild to moderate level of fatigue, so not pushing yourself too much. If you heard, Dr. Coulis-Reed speaking yesterday, she talked about, someone who just started with walking around their dining room table. That was their energy level, that was all that they could do. You don't wanna end up more fatigued by the physical activity that you're doing, so you can break it up into like just getting up every hour and walking around your house and then sitting back down. So really trying to stay within whatever's manageable for you and not making your fatigue worse because you do want to be as active as you can be, but if you're finding that it significantly increases your fatigue, then it's too much and you need to dial back.
Absolutely. So, CM, I'm getting a message from our backstage crew that we actually have a little bit more time together.
Oh,
So, just wanting to make sure that we get to all of the questions and then maybe we can invite folks to take a little bit of a break as well. So, um, making sure that I see that we've gotten to everything. In regards to that, just dovetailing off the question of fatigue, Cindy Marie,
mhm.
would you be able to recommend a good starter exercise for people with pain?
Oh.
I guess it would depend on where
Hmm.
the pain is, huh?
Yeah. I mean, that's a good question. It would depend where the pain is. I mean, talking to your team, making sure that your pain is managed as best it can be, because when we have pain, we often end up tensing up our muscles throughout our bodies wherever that pain is or wherever we hold tension when we're feeling pain. So I think I would encourage the starting point to be talking to your physicians, whether that's your oncologist or your GP, but trying to get the pain under control so that you can do the activities that you want and need to do, and then adding some increased activity on top of that. But something gentle, like just walking is often the easiest sort of entry drug for the exercise.
Hmm.
Dr. Coulis-Reed was saying that she wishes that exercise could be a prescription and everybody would be prescribed it because it just has so many health benefits at all points in our life. But yeah, I think if you've got pain, making sure that you know what to do on a medical level to try to keep that under control, and then just trying to experiment with what feels achievable for you. So if it's walking, if it's just some gentle stretching, Dr. Coulis Reed was suggesting even just like tucking in your chin and then bringing your ear from your down to one shoulder and the other, because we often, I think across the board, we all hold tension in our neck and shoulders. And so just trying to do very gentle stretches like that, just stretching your arms out in front of you, stretching your arms above your head, whatever your range of motion allows you to do, just some very gentle movements. And if you can tolerate it, just doing some, like, I call them chair squats. So when you're sitting on a chair, if you cross your arms over your chest, if you don't need your hands to stand up, and just trying to stand from a chair for like 4 slow counts and then sit back down, but don't touch the chair for 4 counts and just do sort of some squats. So if you do get too fatigued, the chair's right there behind you. But just see how many of those you can do. You'll feel your big quadriceps, the muscles in your thighs will start to work, quadriceps and your hamstrings and your glutes. So those big muscles are so important for balance and just in general for strength. So you can challenge yourself just even with something as simple as that. And just even, 1 minute of that little exercise will help to keep those muscles strengthened. Um, and yeah, hopefully, as long as it doesn't cause you pain and stop before you get too fatigued, but then building up from there. So it can be very simple movements.
Oh, Cindy Marie, thank you so much